Yeah, which might be slightly better than, oh, sorry that you went through that or those horrific experiences. You really need to work on those issues. Got insurance for counseling? No. Take these pills, which is basically the approach. Which is why there have been, international movements like co-counseling or reevaluative counseling, in which lay people get together. And part of what this is about the problem can clear if you share or talk about it with somebody else. Only problem is if the two people that aren't trained, a listening ear might not be enough. You might actually have to have somebody with skill. Because as you may have noticed, like if you've gone through a breakup, right, and you have mutual friends, and you can't go to your friends anymore because they don't want to take sides, and you eventually find out nobody wants to hear about your breakup. Get over it, right? That's what they say. Get over it. Well, that ain't helpful, right? Does that need Prozac to treat that? A breakup? More chocolate? Quarts of ice cream? I'm not trying to make light of it. I'm saying look at what our coping systems tell us to do.
And underneath that is brand loyalty.
Well, there is that too. I'm partial to Haagen-Dazs rum raisin, but
I'm into Prozac too.
Okay. I'm not into Prozac, but yeah.
Not the generic.
All right, so I exaggerate slightly. So you have a psych diagnosis which describes symptoms and how one might act as a result of them. The cure is implied but not always described in a diagnosis. So usually when you're given meds after your 50-minute counseling hour, if you get that 50-minute counseling hour, our time is up. Now the counselor may give you homework to do before the next session, but bottom line is dual diagnosis is an addiction on top of a mental health condition. So what we'll find often, and one of the things to look for, is that people might have had horrific, shattering experiences, and in the absence of good counseling care, will simply attempt to self-medicate to treat those symptoms themselves. And this is where that language comes from, maladaptive behavior, because the theory is a doctor that treats himself has a fool for a patient. Right? So, self-medication, not a good idea. In that framework, this is where that's coming from. Maladaptive behavior, the science. Doctors don't treat themselves, they go to other doctors to treat them. You don't treat your own family, you take your family to other doctors. And they do the professional courtesy thing, treat you for free or whatever. Ethics. Yeah, professional ethics. So, dual diagnosis is an addiction on top of a mental health condition. So in terms of the working theory of, because people like this, one may have led to the other. So untreated mental illness, self-medicated with neurotoxic addictive drugs. Okay, there was a mental illness that you treated with methamphetamine, which is basically methamphetamine is like brain cancer, so not a good idea. To treat your depression with meth. Or untreated substance abuse with toxic addictive drugs leads to brain damage and resulting in mental illness. That is, drugs made you crazy and you're crazy while on the drugs. Sorry to be pejorative, I could say mentally ill, but you know what I'm saying. Okay? The medical protocol is abstinence for 6 months. If the mental illness clears, it was caused by the drugs. That means you also have to make sure that people are actually not using anything. Okay, if the mental illness doesn't clear, well, we'll give you stabilizing meds and therapy and stabilizing meds. Don't use illegal substances on top of your meds, and don't use other people's meds. Now, what often happens, especially with duals, is that the side effects from the psych meds are so disturbing, people will like smoke weed to mellow them out, to cover up those particular symptoms. Now, because we don't live in a, I'm going to be pejorative, a real medical marijuana state, okay? A real medical marijuana state would actually test all product so you know what the constituents are in the pot that you're getting and how much, like real medicine. Like how many milligrams? Like there's this preparation made in Canada. It's a pharmaceutical drug. It's called Sativex. It's made from cannabis. Squirt. 65 milligrams of THC every squirt. An inhaler. That's medical. Pharmacologically pure, measured dose, each and every time. You know how much you're getting. They basically use it for cystic fibrosis, among other things. Right? We don't have anything like that in the States. The Colorado approaches it because they test everything. But in any case, people are, it's not, can't smoke more buds to get more medical effect. That don't work. That ain't science. So I want to run through some drug interactions. So the concept of dosage and potency. Dosage has to do with how much of the active ingredient of the drug is present. Potency has to do with how powerful the drug is in its class. So for example, for alcohol, there's beer and wine strength alcohol, which is anywhere from 2% to 19% of the top end of wine. Then there's distilled spirits, which go from 20% up to 100 proof for Everclear. Then opium, which is basically the natural, raw, unprocessed product. Morphine, which is the first refinement product, and then heroin, which is another refining of morphine, and then fentanyl, which is an artificial opiate. And then OxyContin, et cetera, et cetera. So these first three are the basically naturally derived synthetic concentrates of the drug, and fentanyl, oxys, et cetera, are artificial knockoff, basically, okay, which are more powerful. So potency has to do with how powerful the drug is in its class. Right? So, all drugs have effects. Side effects is a marketing term for normal effects of the drug you can't make money on, but have to declare. Okay, so for example, aspirin, salicylic acid, in white willow bark, the original form. You boil it, make tea, you get some salicylic acid, or you synthesize the salicylic acid out of the white willow bark, you have aspirin, salicylic acid. It dilates blood vessels in the brain. That's its primary effect, and that's how it works to get rid of headaches. As a side effect, it also causes gastric irritation because it partially dissolves the mucus layer of your stomach, which is how your stomach protects itself from acid. Because salicylic acid and hydrochloric acid get together, and so if you take, there was a time when people actually, you drank Coca-Cola and ate aspirin together to get high, and it works, but it also eats holes in your stomach. I don't know if you've ever done the childhood trick of dropping your teeth or a nail in Coca-Cola and leaving it for a week and it disappears. Well, imagine what that's doing to your stomach. Your stomach acid is more powerful than Coca-Cola, but Coca-Cola and aspirin together, don't try this at home, okay? Can eat holes in your stomach. It's basically, that was a prison thing that people did, right? But All drugs, so the side effect of aspirin, the reason I take a kitty aspirin is because of that dilation for high blood pressure and to prevent strokes, et cetera, et cetera. That's a side effect. So a side effect is a natural effect of the drug that you can't make money from, so you don't talk about it. You know? And you'll see this in drug commercials. By law, they have to tell you about oh yeah, the little blue pill. Oh, but if you have a hard-on longer than 5 hours, see a doctor because you might be dying. Or take this antidepressant pill and you'll have sexual side effects. Yeah, right, because it controls arousal or whatever. So all drugs have effects. Side effects is simply a marketing term. Right? You tolerate the different drug effects at different rates with each particular drug. Okay? So all drugs have multiple effects in the body. All right? And so you're taking the drug for a particular effect, and the ones you notice most are the first to go. Not because you're paying attention to them, because your nervous system is designed to adapt. Okay, so if you were self-medicating for marijuana for your anger, you keep self-medicating with the marijuana, the anger effect stops working because the anger effect is primarily euphoria or pain relief. So what you do, you keep smoking, well eventually it still plateaus out, so it stops working. It's appropriate self-disclosure to say, the reason I stopped smoking weed for anger control is it stopped working. I was still way pissed off for a good reason, and the marijuana wasn't working. Meditation works better. You don't develop tolerance to that. Okay? Which is why people, because of that whole tolerance piece, is why people take more of the same effect, the same drug attempting to duplicate the same effect, but tolerance means you'll never get that pain effect again. That's why with opiates, pain relief is the first effect to go. That's why you have to keep more and more until finally, when you're hooked on it, it's not stopping the pain. And you're taking it just to keep from becoming dope sick. So drug interactions, additive. So two or more different drugs in different drug categories act on different parts of the brain and nervous system. This can be really dangerous, particularly in the four loco sense, particularly in the Red Bull sense. Okay? So we knew years and years ago that sobering some person, a drunk person up using coffee didn't work. It just simply meant they were awake for the accident. Okay, because the alcohol is working on is a general depressant, but the caffeine is working on a arousal part of the brain. So great, you're still drunk, but now you're awake, where the sedative would have knocked you out. Now this drug is keeping you awake, right? So the same thing with Red Bull and vodka, or the preparations where they use Red Bull with any form of alcohol, or that stupid Four Loko stuff. Okay, we knew 30 years ago this doesn't work. Now what? These kids don't remember? Or, no, they never knew. So they're just responding to the colorful can. Oh yeah, and I can party more and drink more. No. You can still overdose. All right, so caffeine and alcohol, marijuana and caffeine, speedballs and parachutes. Okay, so speedballs, heroin and stimulants, like cocaine and methamphetamine. Parachutes, one name for parachutes is heroin and methamphetamine. So cocaine has a shorter half-life than methamphetamine, so that's usually the speedball. The parachute, basically the idea of taking these stimulants with heroin is that the stimulants cut the down of the heroin, and the heroin takes the edge off the stimulants. Okay, so heroin and meth, that particular combination has been called historically a parachute. I mean, might be, some people use speedballs. It has that particular combination, but the idea of it, when it's called the parachute, is the meth takes you up, the heroin cuts the edge off the meth, and you float down rather than crash as you would with cocaine. So, drug interactions, potentiating or synergistic, that means the same thing. It's essentially a multiplicative effect. So basically, alcohol with nearly anything else, particularly other sedative, hypnotic drugs or opiates. So sedative hypnotics are basically all your benzodiazepines, your barbiturates, et cetera, They're all in the same drug class as alcohol, but the way alcohol works in your body is it's so toxic from the point of view of the liver that your liver virtually ignores every other drug until the alcohol is gone. And all drug doses are calculated to work with the liver and be broken down. That's why you take X amount of drug every 8 hours or whatever it is. That's basically the half-life of the drug. That's why it's time to do that. But in the presence of alcohol, and that's why it will tell you on the label, don't drink this with alcohol, eat it with food or whatever, but don't do it with alcohol because toxic levels of the drug can build up in the presence of alcohol. So particularly, drinking alcohol with benzos or downers and or opiates can depress your breathing, kill you. Now, some of this can be offset with tolerance, but not really. Might buy you a little bit more time, but. So also what happens, and we talk about this in the treatment segment, basically potentiating, since it's multiplicative, means you're shooting your tolerance up artificially and unpredictably. Meaning you can't sustain that use because doing something that didn't kill you 1 week, doing the same thing might kill you the next week or later on. So it does push your tolerance up, but that means you just had kind of like the luck of the draw and didn't code, as they say. So 5 types of drug tolerance and cravings and withdrawal. So there's metabolic tolerance. That is, the body breaks down the substance, that is metabolize it, that's the liver, and gets better at it with continued exposure to the substance. That's why you don't get as high or drunk and why you have to use more. Behavioral tolerance, in the continued presence of the drug, you can, as we used to say, maintain, act normally, function to outward appearances while under the influence. This leads to using more. And then tissue tolerance, which is where the body needs the substance to function normally, and without the substance goes into a withdrawal, which is the body's attempt to return to normal non-drug functioning. So this is the level that addiction happens, if it happens with that particular drug. Tissue tolerance is not developed with like LSD, for example. But the experience of using LSD can be addictive in terms of its effect on you mentally.
I heard someone say like it's because LSD is stored in your spine or whatever, that if you pump your back, you could just like go into a trip like that.
Yeah.
No.
Not really.
I didn't think so. Kind of thing.
Reverse tolerance, which is a sign of liver damage. It means there's less liver because it's been lunched in the presence, for example, of alcohol or other drug combinations. Therefore, less ability to process the drugs, so you get drunker faster. Takes less to get you drunk because you have less liver. Not a good sign there. And cross tolerance within a drug class, tolerance to one is tolerance to all. So benzodiazepines give you tolerance to alcohol. Alcohol gives you tolerance to benzodiazepines. If you use the most potent in a drug class, that's the level of tolerance you have. So once you're addicted to heroin, lesser potent opiates don't work for you anymore. So we'll continue on Tuesday.